Very pleased to have back with us the senator for the great state of Louisiana, Dr. Bill Cassidy, joining us. Senator, how are you? Good morning.
Jeff, I am fantastic. How are you, brother?
Very good, very good. Welcome aboard. And I know you've got a big announcement coming up later on today with the Transportation Secretary, right?
Yeah, Elaine Chao will be down here to announce a major infrastructure development. Very excited about it. It's going to it's going to lead to the creation of lots of jobs. And if there's one thing we can say about the Trump presidency, we have successfully been creating jobs in our country for working Americans with better wages and better benefits. We're starting to see wage growth now as an example, but inflation sells stable. The Trump economy is a great economy, and this is one reason why it's become a great economy.
You know, what I've been really excited about is to see manufacturing jobs really on the upswing, and just to see all the people that are now working. I think we've got the most number of Americans working all time, Senator.
Well, under the Obama years, people left the workforce. Workforce participation was at an all-time low or something like that. And now we have people getting off of disability back into the workforce. We're still not back where we were probably in 2001, but we're moving in the right direction, and that's a good thing. And if you look at specific groups, for example, veteran unemployment is at like an all-time low. Women employment's great. People of color have all-time high employment levels. So we've got a lot of good things happening. Imagine that. You cut regulations, you cut taxes, you let people keep more of their money, and the economy takes off.
I know.
It's an amazing thing.
It worked in the 60s, it worked in the 80s, and it's working again, Senator. So history is a great guide for us if we would just follow good examples from the past, like the Reagan years. I mean, those were boom years, and I think a lot of that is attributed to the great tax cuts that he instituted when he started.
I'll tell you, partly, Phil Gramm is a former senator from Texas, and I heard him say once that the Obama administration just tried to tie the economy down and beat it with a stick. And every time you spoke to somebody who was a job creator and blamed them for making too much money, blamed them for whatever, they're just pulling in their horns. They're not making investment. They're not creating new jobs. They're building up cash in case their taxes go up. So
Exactly.
When you come in with the president that'll sign Republican principles into law, those folks who create jobs immediately start to expand, and now we got more jobs.
Senator Bill Cassidy with us. Big announcement today. You'll be with the Transportation Secretary, Elaine Chao. They're going to be visiting the Port of New Orleans, announcing a $45 million grant for the Belle Chase Bridge and Tunnel Project. Really great news. Senator, I also want to talk to you about some of your new ideas to lower health care costs. You know, during the Obama years, that was a real problem. My premiums went up 600%. You had so many of the listeners out there have tremendous problems with their health insurance. Obamacare didn't deliver on anything as to what we were promised. Now the individual mandate is gone, but we still have some challenges as far as health care. So can you share with us a few of these ideas that you have?
Totally. If you looked at what happened during the Obamacare writing, which obviously I've done my best to try and do something about, everybody was at the table but the patient and the taxpayer. So since you've seen that everybody was at the table, for-profit hospitals, pharmaceutical agencies, companies, et cetera, have really done very well financially. If you had invested in their stock in 2010, you'd be a millionaire now, if you started off as a thousandaire. But we're trying to change that. How do we put the patient in control? So one thing we're talking about is price transparency. Imagine that. The doctor orders a CT scan for your baby. You scan a barcode. It would tell you you can go down the street right now and spend $2,500 for the CT scan, or you can go Thursday at midnight and get it for $250. Hey, you're going to look at your child. You're going to say, honey, we're staying up Thursday night. So we need to have price transparency where people know the cost of something before they get it, and there's actually competition for their business, and that competition drives down cost, increases quality.
Now, what about drug costs because, I mean, that's been a real problem, skyrocketing drug costs for Americans. I know you have some ideas on what we can do about that.
Huge drug costs is a big problem. If I go to church and I got a Bernie Sanders and a Donald Trump supporter both grabbing my lapels, they're talking to me about drug costs. So across the spectrum, people are concerned about this.
Right.
Now, our solutions are different than Bernie's. But one example, there are, right now, if you go to the pharmacy, Jeff, and you order and you get a medicine, it is possible that your pharmacist, by contract, is not allowed to tell you, Jeff, if you pay cash for this medicine, you'll save money compared to if you pay your insurance deductible. So the insurance deductible is more than the cash price, but the pharmacist is not allowed to tell you that, otherwise they lose their contract with the pharmacy benefit manager. That is wrong. That is so totally wrong. So we just got legislation passed this past week out of committee, and we're working to get a vote on the Senate floor to send it to the president that would outlaw that practice. A pharmacist can tell you the cheapest way to go and is not being restricted by some contract with somebody who's going to make money off of you paying too much.
We're visiting with U.S. Senator Bill Cassidy, who is here for a big announcement. Jeff Career here at Ringside on WGSO. Senator, Obamacare has been such an issue over the years, and we're seeing some progress now. I like your ideas. Are there some plans to just finally put this thing, to put it into the dustbin of history and get rid of it, Obamacare, the remaining vestiges of it?
We've actually done a fair amount already that folks may not recognize. You mentioned in your opening segment, you recognized it. We got rid of the individual mandate. And one of the things people hated most about Obamacare was the individual mandate. That is now gone. So the federal government can't penalize you for buying something that you cannot afford, which is kind of crazy. So we are making progress on that. On the other hand, policies are still way too expensive. And so I'll keep on pushing, Jeff. There's ways that we can make it more affordable for the patient, but we got to have at least a little bit of cooperation from the left, because we need 60 votes in the Senate to make it happen. And if they don't want it to, they can stop it.
I'm going to be visiting coming up tomorrow, Senator, with the Secretary of Health and Human Services. So looking forward to a discussion about some different ideas on how we can improve health care in this country and what some next steps should be. Have you been pleased so far with the cooperation from the administration on some of these proposals that you've been working on?
Totally. I have people interested in my healthcare ideas. You go to my website, cassidy.senate.gov. We have an 8-page white paper. It sounds dense. It's not. How to lower healthcare costs. And we put that up a couple months ago. Since then, the administration is totally in sync with us. And whatever they can do along these lines, they are putting out rules and proposed rules that would achieve that which we talk about. In the meantime, we're also putting up legislation. So we have the Congress working on it. We have the administration working on it. But like every week, my staff and I will communicate saying, look, this is one more thing we talked about that Secretary Azar is now pushing. For example, they're proposing a rule that hospitals have to publish their prices. Price transparency.
I like that idea. I like that idea.
Now, the hospitals aren't going to like it, and they're going to tell you why it can't happen. But why, if it costs you $4,000 to get a colonoscopy one place and $2,000 someplace else, shouldn't you know that?
I mean, we need to empower the patient, don't we, Senator?
Totally. There was that NOLA.com article a few months ago, maybe a year ago now, of the woman that goes to get her blood test, and she gets the bill. A week later, it's $324, but she found out she could have gone someplace else down the street and gotten it for $34.
Wow.
So a 10 times difference in what she paid for the exact same blood test, but she didn't know about it. We just got to correct that.
Senator Bill Cassidy with us, Jeff Crouere here. It's ringside on WGSO. So how is Judge Kavanaugh looking? We're hearing it's going to be a battle royale as far as his confirmation coming up.
I think it might be a battle royale, but he's going to get confirmed. The guy's an incredible person. When he spoke, he was in the East Room. The president brings him out, and I happen to have the privilege of being invited. And he speaks about he went to high school, to Jesuit school, and their motto was meant for others. You can see that is his life ethic. The guy is a district court judge, but he spends his weekends with his wife serving soup at a St. Vincent de Paul kitchen. And I just happened to run into a neighbor of his, and she goes, oh, he's a great guy. He coaches our children's soccer team. I mean, he just lives his life out, expressing his faith in a positive way.
Yes.
Liberals endorse him. And they say, listen, he's conservative, but he's such a good judge, he should be a justice. Now, the Democratic base is going to go crazy, but I think he gets in.
Well, explain it to me, because right now the Republicans have 51 seats, but of course John McCain is not there. So you have 50 votes. So if one defects, then you've got a problem, though, right, Senator?
We got a problem, but I think Kavanaugh gets through. Rand Paul said he was going to support him, and Rand at least was saying he wasn't sure. Susan Collins, Lisa Murkowski in the past have, people said, well, they're going to vote for him, but they actually voted for him when he got on the D.C. Circuit Court. I think there ends up being some Democrats that vote for him. McConnell is being so shrewd about this. Mitch McConnell, the Senate Majority Leader. Right. He says, we're going to vote for him before the November election. Now, you can, speaking to Chuck Schumer, if you will, you can delay the vote, but we're voting for him before the November election.
Good.
So a Joe Manchin, where Trump is incredibly popular, is either going to vote with Chuck Schumer or he's going to vote with Donald Trump.
Right.
He's up for re-election.
Right.
So McConnell says, listen, I'll have the vote the day before the election if you want. So that when people walk into the polling booth in West Virginia, they can say, does Joe vote with us or does Joe vote with Chuck Schumer?
And what does John Tester do? What does Claire McCaskill do? What does Joe Donnelly do? What do all these Democrats in these red states do, Senator?
I think they're all in the same box, where they either vote for an incredibly qualified person nominated by a president who's very popular in those states, or they vote with Chuck Schumer, the guy from New York, who is probably not popular in their states. So I think it's going to be, McConnell has set this up very well.
Well, he's a veteran, so he should know how to navigate this, and I'm certainly hoping that Judge Kavanaugh gets confirmed, because I agree with you. I think he'd be an outstanding addition to the Supreme Court. And finally, I know your time is limited. What's the latest on flood insurance? Because I know that's been a big topic of discussion on our program, and a lot that has been focus of our delegation up in Washington.
Yeah, flood insurance, obviously, big issue for we in Louisiana, but across the nation. It almost lapsed, and there's a couple senators who wanted reforms. I went to them and said, listen, I want reforms too. We got a reform package up there. We think we can get it passed, but don't let it lapse even temporarily, because by law, you got to have flood insurance in many areas of the nation, certainly in Louisiana, to buy a new home. If we let it lapse, it just means that someone can't close on their home, or someone can't renew their policy just before hurricane season. They saw that. They agreed to it. They understand I'm working for reforms. We're trying to make the program more affordable, more sustainable, more accountable to the taxpayer. We got 4 months to pull it off. We extended the program. Steve Scalise did a fantastic job setting us up. The program is extended through hurricane season. We got 4 months to try and bring it home. We're working it so hard, trying to get both the House as well as Democrats and Republicans on board so we get it to the president's desk.
What do you think is the main stumbling block for a more permanent solution here?
House Republicans absolutely want privatization. Senate Democrats absolutely don't. So we're trying to do, by the way, in Louisiana, the analysis is that if there's at least partial privatization, 60% already. So it could be a very good thing for us.
All right. Well, Senator, we're breaking up a little bit there, but we appreciate your time as always. Look forward to our next visit. And thank you so much for joining us right here in the Ringside program.